All right, good evening. For some reason, um, Screenomatic is unable to upload my recordings, so I have to record them on my phone and upload them to YouTube. But today we're going to be going over how the endocrine system hormones influence the development of reproductive uh, cycle. Um, Mainly, there are four questions that we will go over that will be answered. Um, the questions will be what hormones are involved, um, what cells do these hormones interact with, what effect do the identified hormones have, and what additional actions do the hormones have besides reproduction. So, in both males and females, um, the hypothalamus pituitary gonadal axis is the hormonal system that controls the release of sex hormones. Um, The main sex hormones will be FSH, which is short for follicle stimulating hormone, and LH, which is short for luteinizing hormone. Um, those are the main similarities between male and female. Where they get different is in males there's testosterone, and in females there's mainly estrogen that are responsible for the development of secondary sex characteristics. So, if we go off of males, starting at puberty, the hypothalamus uh, produces FSH as well as LH. FSH um, influences the testes, more specifically the Sertoli cells, to assist with sperm production. In other words, spermatogenesis. LH works on the interstitial cells, um, and they produce testosterone. Testosterone is the hormone that also assists with sperm production. There exists a negative feedback loop within this hormonal system. So, when high testosterone levels are detected in the blood, um, the same cells that help produce sperm, the Sertoli cells, produce a hormone called inhibin. So, once inhibin levels increase in the blood, it acts on the hypothalamus to stop producing FSH. Um, as a result of decreased FSH production, the production of sperm decreases, so you can keep sperm levels within the body at a healthy level. In females, which is similar to the males in terms of FSH and LH presence, the anterior pituitary is the structure that produces FSH and LH, as well as estrogen and progesterone. Estrogen is responsible for the secondary sexual characteristics and development in females. It also helps with endometrial growth as well as calcium absorption. So that's one thing that estrogen does besides reproductive functions. Um, a lot of times, women who have hit menopause have decreased levels of estrogen, and as a result, they take calcium supplements to avoid osteoporosis. Um, Progesterone is actually produced by the ovaries, um, as well as adrenal glands, um, and this is a hormone that helps the body be ready for conception, pregnancy, menstrual cycles. Um, FSH is it helps stimulates follicle development. Um, these follicles produce inhibin. So instead of Sertoli cells in males, it's the follicles in females that produce inhibin, which decreases the levels of FSH production. So